Hello and welcome. Thank you for your interest in this short presentation about the personal outcome measures. This presentation is intended to provide a brief overview of the personal outcome measures for your use. To start with, we always like to share a little bit about CQL. Our vision and our mission is all about people and community, dignity, opportunities. We really are focused on personal quality of life and feel it's critical to look at how to define, measure, and improve that over time. Rather than me talk to you through the information about CQL, we've got a short video that I think will be helpful for you.
The history of CQL, the Council on Quality and Leadership. Since 1969, CQL has been a leader in working with human service organizations and systems throughout the world to continuously define, measure, and improve quality of life and quality of services for youth, adults, and older adults with intellectual and developmental disabilities and psychiatric disabilities. CQL's vision is a world of dignity, opportunity, and community for all people. CQL believes that every person deserves respect, dignity, opportunity, and to be included in the community, whether they have a disability or not. That vision drives our mission of being dedicated to the definition, measurement, and improvement of personal quality of life. CQL has a long and rich history of conducting accreditation, training, certification, research, and consultation. We were formed in response to the injustices and deplorable treatment of people in public institutions being brought to light in the late 60s, early 70s. In 1969, a national planning committee under the Joint Commission on Accreditation of Hospitals, now the Joint Commission, including industry leaders like AAIDD, the ARC, the Council for Exceptional Children, and United Cerebral Palsy, led to the creation of the organization which is now known as CQL, the Council on Quality and Leadership. The first edition of standards, which contained over 700, was developed by CQL in the early 1970s in an effort to end the inhumane treatment and abuse of people with intellectual disabilities in state institutions. CQL then took on a leadership role in developing expectations for community-based services, which were the basis for landmark court decisions like Wyatt v. Stickney. Federal courts later merged CQL standards into legal settlements in Texas, North Dakota, California, Arkansas, West Virginia, and other states. CQL was reorganized as an independent, not-for-profit organization in 1979, most commonly known as the Accreditation Council. Anchor and the Autism Society were added to the founding team of organizations at this time. CQL continued to develop new and updated national consensus standards throughout the 1980s. The Healthcare Financing Administration, HCFA, now known as Centers for Medicare and Medicaid Services, CMS, based its regulations on the CQL standards, which were ultimately published in CQL's 1984 edition of Standards for Services. In 1987, the revised Standards for Services for People with Developmental Disabilities was published. In 1990, CQL began work on what were then called the Outcome-Based Performance Measures, now known as the Personal Outcome Measures. We will talk more about them in just a minute. In 1997, the organization was renamed the Council on Quality and Leadership, or CQL. The Quality Measures Model was introduced in 2005, integrating multiple CQL tools, including shared values, basic assurances, responsive services, personal outcome measures, and community life, all into one cohesive package. CQL's What Really Matters initiative came to life in 2010 and outlined 34 success indicators that characterize person-centered supports and promote personal quality of life outcomes, which together result in person-centered excellence. Now back to the personal outcome measures. In the early 1990s, CQL realized that people who use services needed to be included at the table. CQL began work on the now internationally recognized personal outcome measures. Some people refer to the tool as the PALM. CQL invited people with intellectual and developmental disabilities, people with psychiatric disabilities, families, and other thought leaders to participate in focus groups to discuss quality measures. There was a big difference in what people and their families wanted compared with what professionals wanted. The personal outcome measures were developed and piloted in 2 states, at 3 organizations, and then field tested in the US and Canada. In 1993, the first PALM tool with 30 outcomes was published. Over the years, data analysis led to the combination of several outcomes reducing the number to 25, and then to the 21 we have today. The personal outcome measures were revalidated in 2017 and reorganized under 5 factors. The CQL journey continues with the daily work of establishing real connections between disabilities theory and practice. The CQL portal data system now contains tens of thousands of PALM interviews, as well as hundreds of basic assurances assessments. Quality of life is why CQL is committed to partnering with providers and systems for organizational transformation.
So that's a little bit about CQL, our history, and it touched on the personal outcome measures that we'll talk much more about in this webinar. So data is a huge part of our journey of gathering information and using that information to inform what we do, and we support organizations to do the same. For us, it's critical that we measure quality in the right way. And for us, that means looking at everything through the lens of the person's perspective that's actually receiving the supports and services. So the personal outcome measures, really, what are they? The personal outcome measures is a person-centered discovery process, and it's exploring whether things are present, how important things are, whether outcomes have been achieved, along with all the information about the supports to help people acknowledge those outcomes and work toward them. This is a brief overview that, just as you heard in the short video, the PALM tool was developed starting back in the early 90s, and much work over time has continued to refine and continue to validate this tool. So what's so different about the personal outcome measures? Well, most importantly, the outcomes are defined by the person, individual by individual, their preferences in the context of their life. And so the spotlight is on what's important to that person. And then those outcomes, once identified, base action for those people providing services and supports in a way that makes sense for the person. So as you saw in the video, the personal outcome measures, there are 21 of them, and they are categorized or laid out in 5 different factors, we call them: my human security, my community, my relationships, my choices, and my goals. I'm just going to walk through those very briefly. The manual is available for a free download online to get into more of the details. So my human security covers the outcomes about people are safe, people are free from abuse and neglect, people have the best possible health, people experience continuity and security, people exercise rights, people are treated fairly, and people are respected. So under each of these outcomes, there are in the manual a list of suggested questions that would help you gather information as you're chatting with somebody about these topics. And it will go into more about the values and really the definitions. A couple that you might note, it says the best possible health. It doesn't say perfect health, or it doesn't say people are healthy. And as you look in the manual and understand more about the values, that would make more sense. Exercising rights, far beyond the list of service system rights that people tend to think about. So those are just a few tidbits for you to encourage you to go to the manual and read further. So then the next factor is my community. So this is all around people use their environments, people live in integrated environments, people interact with other members of the community, and people participate in the life of the community. And again, the manual can provide much more detail about what each of those statements actually means, with additional questions to help you discover more about these topics with the person. My relationships, people are connected to natural support networks, people have friends, people have intimate relationships. People decide when to share their personal information, and people perform different social roles. Again, lots more information in the manual. One item to point out, people have intimate relationships, certainly covers what usually comes to people's minds around more sexually oriented conversation, but this is much broader. It's who is your confidant? Who do you share your most prized secrets with, or your excitement or your disappointment? So intimate relationships is much broader than what it might appear on the surface. My choices, this is all about people choose where and with whom they live. People choose where they work, what they do during the day. People choose services. And then my goals are about people choosing their personal goals and then realizing and celebrating those personal goals. So with the personal outcome measures, it's a two-pronged approach where you're gathering information about each person's individual outcomes, and that really talks to their quality of their life. And then you gather information about the individual supports, which gets at the quality of services. So it's important to understand that it is only possible to measure and really understand the status of individualized supports by first identifying the outcome. You don't know how the supports are doing in terms of knowing the outcomes or supporting them if you haven't been able to identify what the outcome is. So those go together, personal outcomes and the supports. So putting the tool into action, what does that look like? Basically, it's a conversation with the person who's receiving services. And then it's followed up with a conversation from someone in the organization that's supporting them who knows them best. And occasionally, not very often, there might be some information that can be easily gathered from record review, but that is really quite rare. Mostly it's having a conversation with the person and then a second conversation with people who know them well. So that conversation with the person, you're asking, you're listening, you're observing that person during the conversation and their environment that you happen to be in. It's all about discovering about this person. And so it's all about using your active listening skills and all of your communication skills to put people at ease and to be responsive to their communication styles and to really just discover. So we talk about it as a personal outcome measures interview. In practice, in excellence, it's really a conversation, exploring life with a person. Then that second part, that interview with someone from the supporting organization who knows the person best. First, you're trying to find out, what do they know about the person's desired outcomes? Do they have knowledge of what the person wants to be doing? And then if they do, what are they doing to support those outcomes? What are their activities that are going on? What action are they taking to help people achieve those outcomes? So why is the personal outcome measures tool important? Why should you use it? Well, it changes organizational behavior. Staff change behaviors when they know and understand people more as individuals who have identified outcomes, and they're really similar to their own. Staff learn which organizational activities are not being focused on, and which is in fact important to the people. Organizational planning helps with resource allocation, and evaluation also helps change what they're doing as they understand more about outcomes. The organization's role moves from just providing programs and services as they understand them to be, to really supporting people to achieving the outcomes that they value. The outcomes focus attention on the whole person, not just a sliver or the piece that perhaps one organization views the person through the supports they're providing. It applies to the whole person across all services and settings. And this personal outcome approach also results in a different perspective on organizational processes. When organizations realize that supports are methods, not ends in of themselves, they become more thoughtful in connecting services with those identified priority outcomes of the people they're supporting. Organizations start to question whether they should continue supports and services that perhaps they've always done, and there's a strong push to provide those, but they're actually not connected or meeting people's personal outcomes. Using the personal outcomes, organizations often find new methods to increase flexibility, how they make management decisions, giving services and supports personnel, those DSPs, more responsibility, more ability to do what's needed to help people achieve their outcomes. And a focus on the personal outcome measures changes the way an organization looks at itself. Organizations start to link their strategic planning to those personal outcomes. Senior management begins to examine the alignment between those identified outcomes and the services that they're actually providing. Reorganization and refinancing often follow when an organization adopts this focus on personal outcome measures, that approach. And one of the ways that organizations can do that is by using the data that's collected during the personal outcome measures interview. And I'm just going to show you a couple very brief slides to give you just a taste. So across the bottom are the 20 of the 21 personal outcome measures. And what this chart is showing you is the impact when the people exercise rights, that outcome is present in somebody's life, the impact it has on their overall quality of life. So if that one outcome is present, the odds of the outcomes in all of the other areas increase, and in some areas increase dramatically. So critical to be able to understand that. So if you have limited time and resources, what would this chart tell you? It would tell you that you should focus on rights to begin with, and that will have a major impact across all aspects of a person's life. This shows you about how many of those 21 quality of life indicators are present if that one outcome of exercise rights is present. So significantly more are present when people have that one outcome in place. Similarly, when people have the outcome of they have their best possible health, again, the impact on how many of those 21 quality of life indicators that are in place is dramatic. So how to use the data? Certainly, and most critically, using the data at the individual level. That's really at the heart of the personal outcome measures. So by gathering this information with the person and the supports, you're able to inform the services and the plans that you have with that person. And so many organizations use the personal outcome measures as the beginning of their annual person-centered planning process. So you're gathering information, learning what the person wants and needs, and then you can begin to plan and advocate for that. The next level, as a provider organization, you're able to aggregate the data. So you might do multitude of POM interviews and then be able to use that data and look at trends. Which outcome areas are you doing well with in terms of supports? And which are the areas where perhaps you need to apply more time, energy, resources? And for those organizations who are accredited by CQL, gathering POM data is one of the requirements of that accreditation process. And then the data can be aggregated even further at the state level, where state systems or regional network systems can aggregate the data and again identify where should they be spending time and energy in funding, in training, in supporting, and it also assists in reporting to the federal Medicaid system, CMS. So we wanted to cover a few of the common questions. So oftentimes people ask, how much time does this involve in terms of doing a POM interview? So it varies greatly depending on your skill and experience level. The newer you are to doing POM interviews, the longer they will take. The more you do, the more experienced you become at them, the less time they take. We say that the typical time would probably be about an hour and a half for that conversation with the person receiving services. That could range from an hour to 2 or more. It depends. And then for the follow-up interview with the staff who knows them well, probably about an hour or so. You also then want to know that you have to factor in time to gather the data and enter that either into our portal data system or into your own system that you've created. People ask, can POM interviews be done with people who don't use words to communicate? And the answer is absolutely yes. We have resources on our website, and I'll mention those again a little bit later, webinars, guides, articles that help, and there are some specifically around this topic. Certainly, it may take longer and it may include more people to make sure that you're really gathering as much information as you possibly can. Then people ask, how often should you do POM interviews? And again, that's really very much dictated by what the organization is trying to achieve. Some organizations do a personal outcome measures interview with each person they support every year, often as they begin the process to think about planning for the upcoming year. Other organizations don't have the staff resources in terms of time to do one for every single person they support. And so they choose a percentage that they do each year. Oftentimes people do 25% of the people they support each year. So every 4 years, someone would get one. They might also choose to do POM interviews as people come newly into their service system, or when people are having major changes in their life. So again, varies dramatically depending on what the organization is wanting to achieve and the resources available. People ask about who should do interviews. We do recommend that you don't just identify a job classification who's going to be the person who's going to do the POM interview. We recommend that you find and identify those people who have gifts and talents in this area of making people comfortable, be able to have informational, conversational interactions, and provide training and give people the opportunity to do POM interviews, and then really identify people who have a desire to do them but it can be anyone across the organization. And organizations, we have examples of people from the executive director to the DSPs. So it can be anyone. It really is best for someone who has a heart for doing it. Then there's the questions about data collection. We do have our portal data system, which we currently have tens of thousands of POM interviews in there, and people who are accredited, organizations who are accredited through CQL are provided full access to the portal data system. Those people who are trained and become certified as POM interviewers and trainers, which we'll talk about in just a minute, have access to enter their particular interviews. They don't have full-blown use of portal, but definitely can enter the interviews that they do. Then some organizations who do train their staff and certify their staff, but are not currently seeking accreditation through CQL, can pay an annual fee and have full access to the system. Other organizations create their own data collection system. So again, it's a wide variety. And then people ask, what is the training required in order to do a good job at POM interviewing? And so I want to share a little bit about that, about how to get started, training, and then talk just briefly about what certification looks like. So getting started, the POM manual is available on our website as a free download, electronic download. If you want a hard copy, those are available for purchase. And so the first thing is to get the POM manual and begin to read it and familiarize yourself with it. We have many, many free webinars on our website as well. We've done several series about different decision-making webinars. So when you are doing a POM interview, you're guided through the manual about how to make a decision as to whether an outcome or a support is present or not. And those webinars are very helpful with that. There are guides that help you understand, again, free resources on our webinar. And then we have training. So you can go through a POM workshop virtually or in person. There are one-day overviews of the personal outcome measures, a variety of training options. If somebody is going to be doing POM interviews, we highly recommend that they get training if you want that data to really be useful to you, and know that you're getting valid information. There are some opportunities for e-learning courses you can find out more about on our website. And then if you are really seeking to have valid and reliable data and use that to guide your organization, we highly recommend certification. So let me explain to you what that looks like. So there are two types of certification. There's interviewer certification and trainer certification. So for interviewer certification, you would complete a POM workshop that's taught either by CQL staff, or some organizations have internal certified POM trainers. And so you take that workshop, which is basically a week of time where you learn all about the POM tool, you learn about decision making, and you actually have an opportunity to do a couple of practice interviews. Then you would go on to do a little practice after you've completed that workshop, kind of get your feet wet, see how that feels, begin to figure out your interview style, and then you would have a coaching day with CQL where you would observe a CQL staff conducting a POM interview, and then have an opportunity to be mentored and coached through the decision-making process and be able to ask questions and really think through all of the nuances of that interviewing process. And then the final step is where you would have an inter-rater reliability assessment. So you, as a candidate for certification, would conduct the POM interview with CQL staff observing. You would then each independently make decisions about whether outcomes and supports are present or not. And when you compare your decisions, you need to be in at least 85% agreement with the CQL staff's decisions. All of these activities can be done in person or virtually. Obviously, COVID made a huge change in everyone's life. And for us, the positive outcome of that is that we were able to see that we could do these activities virtually in a way that's very useful, very valuable to people. Then if you want to go on to become a trainer so that you could be authorized and certified within your organization or network to train others about the personal outcome measures, there's a couple more steps. So the first two steps are just what we described about becoming a certified interviewer: participate in a workshop, have coaching, and successfully complete an inter-rater reliability assessment. Then the next step would be you would actually observe CQL staff conducting a workshop. And during that week, while you're observing, you would be mentored and prepared and trained so that you were able to then go on to conduct a workshop. And then the last step, again, would be you actually conducting that workshop and then CQL observing and determining your skills are in place to be able to move forward. So just wanted to make sure that you know there are a plethora of free tools on our websites. We talked about those webinars, guides, articles. We do not like to fill up your inbox, so we only send you things you ask for. At the bottom of every page on our website, you're able to sign up for the different sorts of newsletters and information, email blast sort of things, and you can choose which of those that you would want. I really encourage you to go to our website and look at all of those resources. There are so many that are free and available to you. Thank you so much for taking the time to be with us today, and know that you can always reach out to us at training@thecouncil.org to get any of your questions answered. Thank you so much.